and as a result I've had to pull my own teeth, and in those years I've extracted somewhere in the region of 11 teeth.
This is George Glinos, a man who extracted his own teeth after not being able to get an NHS dentist. George from Childwall has been carrying out his own dental procedures on teeth which have become loose. He says he has been unable to get treatment on the NHS for around 4 years. In total, the 67-year-old said he has pulled out 11 of his own teeth, which he keeps in a jar. George claims he rings on the first day of every month to try and get an NHS dentist. However, said nobody is interested in taking on new patients.
So my name is George Glinos. I live in Childwall, and for the last 3, maybe 4 years, I've not been able to get a dentist, a national health dentist. And as a result, I've had to pull my own teeth. And in those years, I've extracted somewhere in the region of 11 teeth. These are the ones that I've kept. And every first of the month, I ring round all the national health dentists trying to get an appointment, with no luck so far. I've had one dentist who has said they will put me on their books, but they don't know when they ring me, and I don't know what I'm doing next. I have one tooth left on my bottom jaw which I can use to eat with. When that goes, I'll be eating baby food, so I don't know where to go next. I've had several appointments, emergency appointments, but they can't do anything for me because my needs are a lot longer than one appointment, and I just don't know where to go next.
The NHS advises against self-treatment, asking people in need of help to call the NHS 111 number or a local dentist. George said he has had emergency appointments, but they are unable to provide the level of dental care he needs.
I just don't know where to go next.
The 67-year-old said he cannot afford private dental care. George said this is impacting his whole personal life, physical and mental health. He takes the matter in his own hands when the affected tooth, which has not had treatment, becomes loose.
And as a result, I've had to pull my own teeth.
He claimed he sees it as a choice of being in pain or trying to reduce the pain for a period of time. A spokesperson for the NHS in the Northwest said, quote, "The NHS recently announced the first reforms to dentistry services since 2006. This will support practices to improve access, including giving high-performance practices the opportunity to increase their activity and treat more patients. Discussions around further changes that benefit patients and staff are ongoing. It is important to note that anyone who is in dental pain or in urgent need of support, help or advice can telephone their own dental practice in the usual way. If they don't have a usual dentist and have an urgent need, they can contact the dental helpline on 0161 476 9651.